Hi everyone, welcome back to my channel. My name is Don, I'm a surgery resident, and today I wanted to talk a little bit about what I wish I had known before becoming a doctor, before going into medicine. There's a lot of ideas we make for ourselves for what we think it's going to be like to be a doctor, and whether that be because of society, because of TV shows, there's a lot of misconceptions. But today I don't really want to talk about myths and things that are different from the reality, but more of what I wish I had known about the realities of being a doctor versus what I had expected coming in. And the first thing I wish I had known coming into med school is that being a doctor is a lot of paperwork and there's a lot of inefficiencies. It's not just about seeing patients, making diagnoses, giving out treatments, and making everyone feel better. There's a lot of paperwork, documentation involved, and a lot of your time is spent charting things, putting things down in writing, physically making prescriptions and discharge summaries or admission notes. And yes, because electronic medical records are becoming more and more popular, these things are a bit more streamlined and become a bit faster for your workflow. But a lot of the frustration also comes from communication within the hospital with other services, like when you want to get a radiology test done or when you want your patient to be seen by another service. There's a lot of logistics involved in that patient being seen and being taken care of. And you can't just snap your fingers and get things done for your patient, even though they are really just waiting for that test or to be seen by that doctor. And obviously, I understand that everyone in the hospital is very busy. There's a lot of patients to take care of, so everything can't be done in the fastest way possible for every single patient. But another aspect of the communication frustration of being a doctor is communicating with the outside services from the hospital. So like a pharmacy, a private office, or even other hospitals that are not communicating with our network. It's very tough to get the patient records from there and to have the information that is relevant to our patient's history because there's not a centralized network for this patient's record. Yes, a lot of provinces now will try to have a centralized record for patients so that you can just look them up and see what their most up-to-date medical information is, but there's still a lot of things that are unknown and that we have to ask the patient, and sometimes they don't even know what exactly was done to them by a certain doctor outside the hospital, and we kind of have to do a bit of guesswork and see if this was important or not. Sometimes we have to call out and explicitly ask for the results of these tests or the assessment done by a doctor outside. Honestly, I really don't want to sound like I'm complaining. I understand that it is part of patient care and that to care for this patient, this is part of my work and why I'm a doctor and why I get paid. But I think every doctor would like to spend more time with patients and less time with paper. And honestly, I know that this gets better as you move up in the ranks. So from a medical student's point of view, you're doing a lot more paperwork. As a resident, you kind of start being more of a doctor and doing more doctor things. And then as a staff physician, you have a lot of people working under you, and they handle the nitty-gritty things, and then you can focus a bit more on your physician duties. But you can't help but think just how much the system could be improved, especially in this day and age where there is definitely software available and there's a lot of things that could help the workflow and help things not get lost. And this, in the end, can affect patients' care, especially when people are not always in touch with each other and there's not a centralized system for that patient. So the second thing that I wish I had known, or that I was just a little bit more aware of, is that getting a job as a doctor in Canada anyways is not as easy as one would imagine. And that's relatively speaking, of course. I know that across the board in every field outside of medicine, getting a job is very difficult, and that we are very fortunate to have a certain job security, I would say. I know a lot of people, including myself, get into medicine partially because you know that there's always going to be some sort of work and that you won't struggle to find a decent job. And so especially in a specialty of medicine and especially in surgery, there's a lot of jobs across the country. That is true, but you'll need a bit of flexibility, especially in geography, if you want to find a job that is perfectly in line with what you want your career to be. And let me just explain that a little with an example of choosing a specialty and matching to a residency program. I made a separate video about why I chose general surgery and how to think about choosing a specialty, but I'll reiterate some of those points by saying that it's not just the specialty itself that you need to consider, but also the lifestyle and the job market that is associated with that specialty. Relative to the United States, Canada doesn't have a lot of medical schools. And so if you're trying to do something competitive that has only a few spots per school, you don't really have the luxury of choosing which school you want to go to. And if you don't have the flexibility of moving because of kids, family, spouses, or parents you need to take care of, then that does limit your choices a lot when choosing a specialty. And that translates as well in finding a job. There's only a limited number of positions in a certain area, and if you want to specifically work in that area, then you can't just open up shop anywhere, especially if you work in the public sector in a hospital, for example. Of course, if you open up a private practice, you have a lot more flexibility in where you want to work, but working at a hospital is a bit more limited in terms of where you want to work, especially in Canada. And I know for myself that I envision and I would still like to go back to my hometown to practice and provide my services to the community and to the people that helped me grow up. But I keep in mind that it will not always necessarily be possible to find a career that is in line exactly with what I want to practice in the location that I want to be in. And so basically my point is that it's like any field outside of medicine where there's going to be a lot of job opportunities, a lot of good ones, a lot of less desirable ones. But there's a lot to think about, and I feel lucky that I don't have any particular attachments at this time that would limit my opportunities in terms of geography, and that I can really focus on my own interests and on building the career that I want. And so I'm totally aware that not everyone going into medical school is going to be in the same situation as I am now, and so I feel very lucky. And so to build on that, the third thing that I wish I had known or been more aware of in medical school is that it's even more training than I thought it would be. And yes, I know that I'm young and that relatively speaking, I will have done less school than a lot of people at the end of their training. I still think that it's more school than I thought just because things are getting more and more competitive. By that, I mean that a lot of people now have fellowship training, which are extra years beyond residency to subspecialize in a certain field. And people can go on and have several fellowships and have a lot of graduate degrees, so masters or PhDs that they do during residency. And this a lot of times is to build their CV or to have a more academic practice. But even people practicing in the community now are going to be very, very qualified. So things are definitely getting more competitive. And that's to speak of the general trend everywhere, where everyone has a university degree now. And so in medicine, everyone is going to have residency training. And so to be competitive, to get a job, you have to stand out by getting a graduate degree or getting several fellowships. And it's going to be rare to have just the residency training and stepping into a permanent position. And so I really hope I don't sound negative at all. And in fact, the last point I want to touch upon in this video, and that I wish I had known going to medical school, is that being a doctor is even better than I thought it would be. So we make a lot of ideas and expectations for ourselves based on our past experiences and our ideas of what a doctor is like, but you're never going to know what it feels like to be a doctor until you actually get to do it. And so the amount of knowledge going from basic science to having the privilege of assisting in surgeries and seeing the human body wide open, it's been a wild ride and an incredible pleasure to learn to become a doctor. And definitely the best part of all of that is being able to take all of that knowledge and apply it to help people's lives every day. And I'm not necessarily even talking about making a diagnosis or treating someone for life, but being a doctor also means that you're in the position to reassure people and just talk people out of a lot of things and help people by just discussing it with them, not just by making some diagnoses and giving out pills. And that I find to be the most rewarding thing. I know that every day is not going to be perfect and that there's going to be frustrations from the system, from communications, things not going right. I just find it so hard to imagine that all of the small downsides that are frustrating would not be worth it for the good moments you have when you're seeing a patient and when you can put a smile on someone's face. And so Obviously, I really hope I maintain this excitement throughout my training and throughout my career. And if I could go back in time and see myself in first year, I would let myself know that it's gonna be all worth it and it's gonna be even better than you imagine at that time. So if you enjoyed this video, please leave a thumbs up and leave a comment and let me know what you think. And otherwise, I'll see you in the next one.